With COVID percentage rates reaching nearly 20% in Washington County, Dixie Regional Medical Center's 32 beds in the ICU aren't enough for the surge of patients needing critical care.
We want to continue offering comfortable and convenient care. However, we have opened our surge ICU, which means that we have gone beyond the bounds of the beds that we have in our ICU, and we're now caring for ICU patients outside of our ICU.
While COVID patients are a minority of overall hospitalizations, hospital officials say that too is going up. Nurses are becoming exhausted by constantly changing in and out of hospital PPE to treat these patients. They say this virus is not a hoax.
We do get frustrated with people not trusting the public officials, and you've even heard that it's been called a hoax. It's very real. It's very real. And it can be very exhausting. It takes us sometimes 15 to 20 seconds to get completely dressed, run into the room, and then when we leave the room, we have to undress again. To go back into another room, we have to use another gown or another papper, and after everything's wiped down and get in, go back into the room again, and it is exhausting and hard.
With a total of 284 beds in the hospital, Dixie Regional Medical Center has put out another plea for help in getting control of the pandemic.
To the people that live in St. George and southern Utah, to ask for your help so that we can decrease hospitalizations, so that we can decrease ICU stays, and so that we can decrease deaths occurring because of COVID. We need to turn that around. We need to get the percent positive down. We need to get the total number of positives down.
And it appears the spread of this virus is coming from college-age students, skipping to older generations.
It's continued to spread. The intensity has spread among the 18 to 29-year-olds, and the intensity has spread to other age groups as well. Last week we saw more patients 85 and older, more individuals 85 and older infected with COVID than what we've seen previously.
Strong suggestions indicate mandatory testing at universities once a week to keep the virus from spreading. Dr. Carroll encourages people to get this year's flu shot, but he said the most important thing to do to prevent the spread of this virus is to get tested if you have symptoms.
The recommendation, in order for us to keep one another safe, is to stay quarantined, to be separated from individuals for 10 days from the positive test if in a healthy individual that doesn't have comorbid conditions, that doesn't have immune compromise, and longer for people that do. Additionally, at least 24 hours symptom-free, and that's both, not just one of those.
Besides testing, wearing a mask and staying 6 feet apart, Carroll said that eating together is an inherent risk as well. This may mean spending Thanksgiving without family members you don't live with this year.
Thanksgiving dinners are multi-generational events generally, and there's no question that bringing a group of people together, large groups of people together, will add risk and will almost certainly lead to increased spread. We're asking people to really be cognizant of that and try to limit the distance that you're next to somebody as you're eating, particularly those that are not in your own household.
Anderson said it's also difficult to see the patients who are alone and can't see their family members.
These patients are alone. They are very sick. And we are in their room in what looks like spacesuits, and it's hard for them. The human touch, the connection is difficult. Sometimes we are their only lifeline to their family.
Dr. Ferguson gave a brief demonstration on how a ventilator works when oxygen isn't enough.
Which is called an endotracheal tube, or ET tube, is advanced through the patient's mouth, not into the esophagus, but through the vocal cords and into the trachea, where this balloon is pumped up right here so that it occludes the airway. We can then use this surface to coordinate with the ventilator. And with this, we can provide not only oxygen, but high levels of pressure, because we've occluded the airway here, and we can provide the lungs with an extensive amount of pressure. And that allows us to get the oxygen saturation to rise.
Ferguson said patients may need this tube several weeks in the ICU in the case of COVID-19. Nurses and doctors are becoming weary after working overtime. They are required to work mandatory on-call shifts every 4 weeks. Dixie Regional is still looking for 2 more nurses on each shift to avoid nurses working 18 hours a day.
I've had some caregivers, and for instance, we've had respiratory therapists that have come in from outside hospitals, Primary Children's, Riverton, have been able to send some respiratory therapists down to St. George to help tackle the need because the need is so great here in our community. In addition, we have nurses that will be coming in from outside sources as well, just because the nursing load is too great to continue to bear in this setting.
While the hospital isn't in crisis yet, Carroll said they don't want to be. He describes this pandemic to a race.
This is a marathon, not a sprint. We just don't know what mile we're on right now, so we have to keep on running. We can't give up. We've come too far to only come this far, and we have the opportunity to turn this around, and I'm confident that we can do that.
In St. George, Melissa Anderson, Community Education News.